rare genetic disease, fibrodysplasia ossificans progressiva, as well as researchers and healthcare providers studying and treating this disease. One of the rarest, most disabling genetic conditions known to medicine, FOP causes bone to form in muscles, tendons, ligaments, and other connective tissues. Bridges of extra bone develop across joints, progressively restricting movement and forming a second skeleton that imprisons the body in bone. The IFOPA is a U.S.-based nonprofit organization whose mission is to fund research to find a cure for FOP, while supporting, connecting, and advocating for individuals with FOP and their families, and raising awareness worldwide. You can find us online at ifopa.org. Welcome to today's podcast.
Hello, and thank you for listening in to today's IFOPA podcast series episode. I'm Hope Newport, Family Services Manager at the IFOPA. I'm excited to bring you the third podcast of the 2021 Advocacy Series. Today's topic is advocating in the medical setting. We'll be discussing steps individuals with FOP and their caregivers can take to be active participants in managing their healthcare experience and laying a foundation for optimal care in the medical setting. Here with me today to share his insight and recommendations for best practices on the topic is Dr. Hsiao from the University of California, San Francisco. Dr. Hsiao is a member of the International Clinical Council on FOP. The ICC is an independent group that serves as a global voice to provide best practices for clinical care and research for those living with FOP. There are a number of other FOP experts treating patients around the world. Dr. Hsiao is one of only 4 doctors in the US who specializes in seeing patients with FOP. Thank you so much for taking part in the Advocacy Series and sharing your valuable time with the community. Can you start us off by sharing a little bit about yourself and how you came to be so deeply connected to the FOP community?
Thank you, Hope, for inviting me to be as part of this program. What I'm going to talk about today is my own opinion. It is not the opinion of the International Clinical Council of FOP or the IFOPA. I first became interested in FOP when I first met my first patient in 2007. This was a child who was introduced to me by Joseph Kitterman here at UCSF. And it was very striking to me just how severe the heterotopic ossification was and how little we knew about what to do. I became very interested in this from the research laboratory standpoint because at that time we were interested in understanding what were the mechanisms and what drove this dramatic heterotopic ossification. But then I also became interested in aspects of clinical research and started to be involved in that, as well as clinical care for patients with FOP.
Great. So thank you for, pursuing that interest back then and continuing your commitment to the FOP community today. And I know that over the years, you must have gained a great deal of insight seeing those patients. And in our conversations sort of leading up to today, you shared that you see, approximately 45 families with FOP a year. And that's not even including the ones that you get to visit with at our annual family gatherings. So I'd love if you could kind of frame or start today's conversation off by just telling us a little bit about your philosophy for helping those families when they're trying to set up a care team to support them in the medical setting.
So I think if we're starting from scratch, we can talk about what we would have for an ideal clinical management team. And I think it's a little bit different if you're an established diagnosis, if you're a patient with an established diagnosis, where you're looking for continuity care. And in those situations, I think you would probably want to pick and choose specific components for your care team.
Great. So let's dive into the specifics a little bit now for what can be kind of a complicated, and I'm sure for a lot of people, a very overwhelming process to tackle. What are the steps that you advise or that you would lay out for families or for individuals to take to kind of start building their team?
So I think a critical component in any medical care, not just in FOP, is really having a good local care provider that serves as the primary clinician. And so this primary care provider, or PCP, or generalist, or pediatrician, this person actually serves as the primary coordinator who can integrate input from multiple people. Many subspecialty clinics are really not set up to do primary care. So for example, our clinic here at UCSF in endocrinology can't do immunizations. We don't have very good social work resources because that's not what our clinic is set up for. But coordinating with the PCP, those types of resources may be available. In addition, the primary care physician is really the person who is nearby and can really help coordinate in the event of emergencies or for follow-up care. It's somebody that can be seen easily on a regular basis, particularly in person, and can help respond quickly if there are particular complications or events that need to be addressed. I think one of the things is, how do you find this right PCP? And there is no one size that fits all. Many times it is by word of mouth. So finding pediatrics, like a pediatrician, finding a primary care physician. Some of this will be very much dependent on your insurance, what kind of coverage that you have, the place that you're located at. In general, internal medicine, the adult realm, is in some senses a little bit more challenging because patients require more time, and finding a practice that specializes in complex patients can be very valuable because they will have the experience and the resources. Academic centers may be more ideal because of expertise and potentially slightly looser time constraints, but there are many clinicians in private practice who are excellent and really are able to care well for um, complicated patients. And so you should not rule out primary care physicians that may be in private practice. A lot of this may involve interviewing your physician beforehand to try to identify people who you can connect with and would be willing to help support you. And the types of characteristics that you're really looking for in a physician is really a willingness to take a bit of extra time to understand complex disorders, a willingness to listen and understand what is going on, and a willingness to reach out when additional help is needed or when additional input from specific subspecialty experts may be helpful for your particular care.
And then when you're looking for that, the right primary care provider, you're also sort of looking at the practice that they work within. Can you tell us a little bit about what is important to consider when you're choosing the practice?
Yeah, that's a great question. So a lot of it will have to depend on the type of infrastructure that's present to help manage complex patients. It's very helpful if you know that there's backup phone numbers, that there's somebody who's on call, people that can be helpful for rapid turnaround for either feedback, such as after a flare or for prescriptions, and also emergency care. Just knowing which hospitals that they link to in advance can be very valuable because you can provide them with things like the FOP treatment guidelines so that all of that is in your record and available in the event that something happens.
So then, this is something that we said was sort of ideal. Can you speak to any sort of challenges that may arise for people who live in a more rural area and how they could possibly overcome some of those challenges?
Yeah, so for people who live in more rural areas or in areas that may have less developed medical systems, sometimes these types of capacities may not be as easy to identify. But typically what you can do is you can find people who can help serve as medical advocates for you. You can have somebody who can come in with you as part of the clinical visits to help make sure that you heard and you understood everything, help take notes. Those types of things can help compensate. And that's not just for patients who may be in less well-served areas, but it's actually for all patients being able to advocate for yourself in the future. The other thing is that in many of these other areas, just knowing and exploring how the medical system works and who the different physicians are or the PAs, other sort of mid-level medical providers are, those can be extremely valuable. And there are some very excellent physician assistants and other types of providers that can help provide excellent care. So being able to understand what is the situation in your area is extremely valuable.
And so we've talked about that primary care provider, that person who kind of takes the lead role in organizing your care. But can you tell us about other members of a care team and who else you might want to wrap into the team that supports you?
Sure. So I think, if you look at it of thinking about everything about FOP, there are a couple of different types of people that may be part of your care team. So one thing to keep in mind is that your care team will probably evolve over time and will change depending on what sort of complications or issues that you might be having at any one particular moment. So having a connection with an FOP expert or somebody who has experience in FOP is extremely valuable. Oftentimes, I find that it helps to be able to reach out initially to a new physician and to say, hey, we're here to support you. We can provide information. We're happy to run any questions. And that can often take away a lot of the anxiety for a physician who has never seen FOP before, and allow them to provide better and more comprehensive care. The other person that I think is critical for most FOP patients is dentistry. Having someone locally who can provide excellent dental care and supportive dental care, particularly in collaboration with the FOP expert dentists, that person can be really important, especially for maintaining long-term health of the teeth. And so I would strongly recommend that everyone look for that type of dentist, a dentist to really help out with that type of healthcare maintenance. I think for a lot of other patients, there may be different components. Psychiatry or some sort of mental health support can be extremely valuable, especially since this is a chronic condition. It's also important for family members, primary caregivers, to have access to these types of resources. You may not need it all the time, but having that type of connection can be very valuable, as well as pain management. The hope is that our patients with FOP are not in a lot of pain, but there are definitely times when pain is a major issue. And having somebody who is a pain management expert, somebody who knows all of the different resources, what medications and what non-invasive strategies might be available, those are all very valuable and can be extremely helpful for keeping patients comfortable. If you're able to connect with a social worker or a caseworker, that can be extremely valuable. This is something that some clinics are able to do. This is much better in the pediatric realm, sometimes more challenging in the adult realm, but the primary care physicians can help connect with particular resources. Social workers can be particularly helpful, especially if there are social, economic, or other types of issues that may complicate access to care. And then there are a number of other specialties, subspecialists, depending on complications. This may include orthopedics, orthopedic surgery, cardiology, endocrinology, gynecology, physical therapists, especially for things like seating and mobility assessments. A lot of this is best at the local level because many of these things need to see the patient or need to have specific fittings. And so having a team that is able to help you with that can be very valuable.
Great. And that is a lot for people to, I know, hear and try to manage, that I have all these different components I need to get in place. So I know we both want to emphasize that it's a process and it doesn't happen overnight, but this is, as Dr. Hsiao said at the beginning, sort of the ideal to strive for.
Well, that's a great point because, again, what we're thinking about is the approach for somebody who's brand new and all of the potential resources that you might want to think about to bring into your team. And again, this is not going to be for everyone. Not everyone will need a cardiologist or an orthopedist or something like that. But a lot of this is really making sure, in some ways, sort of a checklist of going through and saying, do I have issues with this particular or do I have concerns in this particular area? And should I have somebody that is aware of what's going on and can provide input? And as mentioned before, I think what's important is that you have access to these resources. You may not need to use these resources all the time, but being able to say, oh, well, there's something going on that's a little bit different with my wheelchair. I need to have an adjustment. I know who my local physiatrist is so that we can go and get that taken care of.
Great. So like other relationships we have in life, we may not always jive right away with a new provider, or we may be working with a member of our team, but then encounter issues sort of later in that existing relationship. So what advice do you have for a patient who doesn't feel like their provider is like the provider they're working with right now is the best fit for them?
Yeah, like you said, everything is so much dependent on the relationship. Um, I think the first is to recognize that everybody's medical needs change over time, and a good relationship may change, and it is okay to adapt and work with the team. And I think what's really important is having open lines of communication, recognizing what are the challenges for your team in order to help you, and what your challenges are in order to get the care that you need. So um, trying to understand those types of circumstances can be extremely helpful. So open communication, just saying, I need to just sit down and talk with you about um, this particular issue that is coming up and how we as a group can actually manage this best together. Being frank and honest about these types of issues and transparent about them can be really the best policy. If this person if you're concerned about contact and how to reach out to a particular team, even just simply saying this is like, how would you recommend that I contact you, or who is the first person that I should contact if such and such an event happens? This really helps establish sort of efficient communications pathways. What would be the best strategy for getting things addressed quickly, and really being able to say, okay, well, I understand, I'm not your only patient for the provider. I'm not your only patient. How can we actually help each other, make this into an effective relationship? And I think through this type of communication, this really helps elucidate the different life circumstances that are going on, and really allows the physician to understand what you need, but also helps you understand what is the best way to actually get the type of help that you need for that particular type of request.
And so if we look at, creating this care team as the first step of putting ourselves in a productive environment to be able to advocate for our medical needs, the next step is probably also discussing some of the patient's responsibilities. So it doesn't stop there. Once you have that care team in place, how can patients really partner with that team and be an active member?
So that's a very important point that you're bringing up, is that this is a partnership. Just like any relationship, there needs to be assistance on both sides. And one of the things that a patient or a family can do to facilitate the optimal care, really, making sure that there's smoother communication, is really being prepared and organized, particularly for visits. And part of this, I think, comes down to a couple of things. One is record keeping, being able to have a good sense of what's going on with you, to be able to fill in the key points. Um, we don't want to overwhelm people with too many records, but I think being able to say, okay, well, um, these are the types of events that have been happening recently that I've noticed, and being able to detail some of those can be extremely helpful. The record keeping could be even simple things, like just keeping a medical journal or copies of key records, things like your genetics testing, lab tests, imaging, because sometimes, even though we live in an age with more electronic medical records, not all of the electronic medical record systems talk to each other. And so a physician may not have access to some of those. And sometimes uh, the that there's just so many records that are present that it's just not possible to go through quickly and identify what the key problems or the key points are. Knowing who your pharmacy contact is, the contact information, the address, the phone number, the fax number, that can be extremely helpful, especially for things like prescriptions. I have encouraged my FOP patients to have a one-page medical history summary. This can be very helpful, especially if things need to move quickly. But basically, the key points and the key events that may be occurring. This, I know other people have described this as sort of like a single point of care document, which I think Hope you were going to talk about separately. But I think that is a really great idea of having information at hand, rapid access to information that could be really important for your medical care. And keeping these materials up to date and making sure that your physician has a copy of that can be great. Even having a list of physicians and their contacts would be extremely valuable.
Several of the things that Dr. Hsiao's mentioned here, these sort of tools for record keeping, those are also topics that our panelists in next month's community panel will be telling a little bit more about their personal experience using, like the single point of care document, or using a medical journal to track things like daily symptoms and those sorts of information.
So in addition to record keeping, I think one of the things that is important to understand is what would be considered responsible contact with the medical team. So not reaching out for small or non-urgent things, or being able to collect them together, into one particular visit, that can be extremely valuable. But each physician and each care team is different. And what you want to do is to make sure you talk with them, as we were talking before, in terms of communication, really understanding what they want to know about, and what would be the best strategy for reaching out if you have these types of questions, so that they can be answered in a timely manner. I think the other aspects that are really important are thinking about your advanced care wishes. Do you have a plan? Things like power of attorney, living will, organ donation. What would you like to do? I know this is an extremely difficult topic. Nobody wants to have to think about this, but this can be a very useful thing, both for making sure that your wishes are followed for your medical care, but also providing guidance for your family if anything unexpected were to happen. Having information about your schools, the types of accommodations, types of letters of support that you might need. This can be extremely valuable. One thing that I have found that can be extremely helpful is drafting a letter for these particular situations. So for example, if there are specific things that you need from the school and you need a letter from your physician for that, if you can draft just very briefly, even an outline of what the key points are, that helps make sure that your letter is tailored to you and addresses the issues that you need, so that you don't have to have a lot of back and forth on that. Having these types of information done ahead of time can be extremely helpful. And then the last thing, which may actually may actually be more important, so that this should have probably been the first thing, is to make sure you share the updated ICC treatment guidelines with your physicians and your care team, so that they have all of that information on hand. And I would point out that at the beginning of the ICC guidelines, is a very short 2 to 3 page executive summary of the key points about FOP. Those 2 to 3 pages are good to keep on hand and to share with physicians and schools and other providers, because that is the 3-page summary version of the entire close to 150-page document that's available.
And so we've talked a little bit about, preparing to be ready when you're in visiting your doctor, with the materials you should bring, what you should have done ahead of time. But it doesn't just end there. There's also follow-up after, and responsibilities that patients have after they leave an appointment. So are there any specific aspects of care management that you would encourage patients to put extra attention towards?
Yeah, I think once you have your visit with your doctor, um, that's partly the beginning of a conversation for the next steps. And I think being able to advocate for your own medical care is really important. It starts by when you leave the medical visit. It starts by looking at what the discussions were and being able to follow up on that care at home. So things like helping track for nutrition, getting quality sleep, um, being involved with respiratory therapy or sleep expert if that becomes necessary, doing your pulmonary exercises, reaching out to other specialists like dental and respiratory support. those types of things may be, I guess the primary contact for some of these events might actually fall on you as the patient or the patient's family to help coordinate. Um,
So
and
it's almost like you have homework sometimes when you leave your doctor's office or your appointment, you have to go home and follow up with the homework that they sometimes will assign or you'll come up with together as a team.
It does. And that also includes things like making sure that you take your medication on a regular basis, and that you're able to keep up on things like prescriptions and making sure that you're not running out of your prescriptions right now and you need to have a refill immediately. Building in that 1 to 2 week time period of just looking ahead and saying, oh well, I only have a week's left of medications left. Now it's time for a refill. Those types of things can be extremely helpful. I think the other thing is to keep in mind that FOP is more than just the heterotopic ossification. We think about the heterotopic ossification because that is really the major outward presentation that people see, but other organ systems can be affected. And so patients with FOP need to be aware of changes. Keeping up with the ICC guidelines can be very helpful with this. But patients with FOP are also at risk of the same medical conditions that the general population has. So, we want to make sure that we try to prevent diabetes, we try to prevent atherosclerosis, heart problems, things like that.
Great. Well, I think that kind of helps us lay a foundation for the skills that are necessary or the steps to take to really set yourself up to be an effective advocate in this medical setting. But now we're going to dive into a few specific situations. And one that you touched on when we discussed, what are the characteristics you look for in a primary care provider when you are kind of choosing and starting that relationship is their willingness to partner with an FOP medical expert. So can you talk just a little bit about, how an individual with FOP can help to bridge that connection between their primary care provider locally and between the FOP medical expert that maybe they consult with on a more national basis?
Absolutely. I think the best thing to do is to make sure that you have regular check-ins with your FOP expert, just really saying, I'm doing okay, or, there are things that are going on. In many situations, uh, the changes recently because of COVID, one of the benefits I think is that there's more telemedicine that is going on, and so this has allowed for a lot more um, facilitated conversations. And there are sometimes situations where you may feel that you need to have someone with expertise in FOP on the line at the same time with the primary care physician. And so offering to the primary care physician that, here's the contact information for one of the FOP experts that I work with, um, or being able to say, okay, well, I am happy to do an introduction or introductory email just to make sure that everything is connected together, can be extremely valuable and facilitate that. I think the other thing is that it's very helpful for your FOP expert to have a direct line or a direct connection with the primary care physician or other member of your care team. Um, this is helpful because it provides a more detailed look at what's going on with you. It provides additional background and assessments and can really speed things up in terms of your help. So making sure that the two physicians are connected together or the two teams are connected together is really important. And then I think one question you didn't ask, Hope, was which FOP expert or how does that work? Who should we talk to? I think that being able to identify someone who is in close proximity and that you have a good rapport with is really important. Somebody that you have the ability to be honest with and to be able to talk about concerns, that can be extremely valuable. And we do have a couple of physicians here in the United States, but I think one thing to keep in mind is that all around the world, we actually have a large number of clinicians who are experts. And so, if you don't live in the United States, you should actually think about making sure that you have good connections with the physicians that are closest to you so that you can make sure that you get the optimal FOP care.
And so now kind of switching gears a little bit, but focusing on another kind of unique aspect of that patient provider relationship is acknowledging that sometimes, you work with your primary care provider, or maybe you work with the FOP medical expert outside of just the medical setting, but that they can help patients in different things like dealing with insurance appeals or accessing support in a school setting. So what tips do you have for families to help be an active participant and support their provider in those situations?
Yeah, so I think in many ways, starting with your primary care physician is really ideal. Um, they have a lot of assistance and a lot of support mechanisms. They know the local regulations and different processes, especially working with your insurance and things like that, in terms of things like getting approvals for durable medical equipment. Um, Sometimes there are going to be situations where you may need subspecialist appeals or subspecialist support. So, for example, if you're using particular medications or need specific guidance for example, in terms of vaccinations, and in those cases, you know, being able to coordinate with a subspecialist or being able to coordinate with your FOP physician, that can be really helpful. And that may be something that you need to think about, in terms of putting together things like a joint letter, and especially if pediatricians or physicians are proactive in this direction, that can be a very valuable way of supporting these types of appeals that you may need.
And I know we also talked about how providing template letters to your physician whenever you can is a really important part of being supportive in that process. And that's definitely something the IFOPA is working on, creating these templates and housing them so that you can get different examples, kind of starting points for some of these forms that you could draft to help your medical provider. So this next question, Dr. Hsiao, shifting gears once again, is sort of focused on the caregivers of, our children with FOP or even adults with FOP who have caregivers who live with them and oftentimes, are responsible and managing the medical care. So what additional levels of support or collaboration might they look for that they might not know to ask for from their primary care provider, but that this new FOP diagnosis or living with FOP could maybe sort of prompt them to need?
I think this is a really important question because in many cases we think about the patient with FOP, but we don't necessarily think about the caregivers. And the caregivers also need to take care of themselves. One of the things that I find very valuable is during the visits is asking, the caregiver, are you doing okay? What's going on? And making sure that someone is doing that. So it might be for a parent, it might be for a spouse, it might be for a sibling, that is present. But being able to make sure that that caregiver's primary care physician is aware of some of these stressors and can provide support, would be very helpful. Um, some of this might actually take the form of being able to ask the caregiver's PCP to say, okay, well, I need some mental health support, or, what are the strategies that I can do to take a break, and make sure that I, as the caregiver, can be there for my child or patient with FOP, um, but making sure that their health is also maintained.
I think I have so many other questions kind of percolating in my mind that I could ask you, and we could probably chat for days, Dr. Hsiao, but we want to keep these podcasts more brief to give people, a digestible amount of information. So I want to thank you for what has been a great conversation so far. And before we close, I wanted to just ask for, any last thoughts you have that you would share with the community before we wrap up.
Absolutely. So it's a pleasure to talk to you too, and I think there's a lot of things that we can definitely share. I think from this for this particular topic about advocacy, I think there are a couple of key points that I would summarize. One is really being able to coordinate your care. So this can be extremely beneficial. This is important for the patients with FOP, and it's important for our patients with FOP and their families to realize that you are not alone, that there are a lot of valuable resources that are available, things from the IFOPA, from the ICC, and even from your physicians to be able to support you uh, in the FOP journey. I think the other thing just to keep in mind is that communication is key. Just like any other relationship, being able to talk it through and to identify what's working, what's not working, and adjusting to accommodate that is really, really important.
Great. Well, this has been such an informative discussion. And Dr. Hsiao, we are so grateful to have you to open up this third quarter's resources for advocating in the medical setting. So I hope that everyone enjoyed this and that you'll all take the time to go back and re-listen. I know there was a lot of great information in there. And don't miss next month's resource. In August, you'll have the opportunity to hear from 3 members of the community who will be joining us from the US, Canada, and Netherlands. And they're going to be sharing their stories and the tools they found most effective in their experience advocating in the medical setting. So you can check out our website at ifopa.org/the_advocacy_series to find sign up details and registration information. And once again, we just want to thank everyone for listening in, and we look forward to connecting with you soon.
Thanks very much for having me on the program.
Thank you, Dr. Hsiao. Bye, everyone.